The axilla, commonly referred to as the armpit, is a pyramidal-shaped space located between the upper limb and the thorax. It serves as a passageway for neurovascular and muscular structures traveling between the neck and the upper limb. The axilla is anatomically and clinically significant due to its contents and the presence of lymph nodes involved in systemic immunity and cancer metastasis. Below is a detailed description of its anatomy. 1. Boundaries of the axilla. Apex cervicoaxillary canal. The apex is directed toward the neck. It is bounded by, anteriorly, the clavicle, posteriorly, the superior border of the scapula, medially, the outer border of the first rib. It serves as the entry point for neurovascular structures from the neck to the axilla. B. Base. The base is formed by skin, subcutaneous tissue, and axillary fascia stretching between the thoracic wall and the arm. It creates the armpit's hollow appearance. C. Anterior wall, formed by pectoralis major muscle, pectoralis minor muscle, clavipectoral fascia, enclosing the pectoralis minor and subclavius muscles. The anterior axillary fold is the lower border of the pectoralis major muscle. D. Posterior wall, formed by subscapularis muscle, teres major muscle, latissimus dorsi muscle. The posterior axillary fold is formed by the latissimus dorsi and teres major muscles. E. Medial wall, formed by serratus anterior muscle overlying the thoracic wall, ribs 1 to 4 and their intercostal muscles. F. Lateral wall, the narrowest wall, formed by intertubercular sulcus, bicipital groove, of the humerus, which houses the long head of the biceps brachii tendon. 2. Contents of the axilla. The axilla contains several important structures, which can be remembered with the mnemonic A, axillary artery and its branches. The axillary artery is a continuation of the subclavian artery. It has 3 parts, defined by its relationship to the pectoralis minor muscle. 1. First part, proximal, superior thoracic artery. 2. Second part, posterior, thoracoacromial artery and lateral thoracic artery. 3. Third part, distal, subscapular artery, anterior circumflex humeral artery, and posterior circumflex humeral artery. Axillary vein and its tributaries. The axillary vein lies medial to the artery and receives blood from basilic vein, cephalic vein, tributaries corresponding to the branches of the axillary artery. M. Axillary lymph nodes, divided into 5 groups based on location. 1. Pectoral anterior group, drains the anterior thoracic wall, including most of the breast. 2. Subscapular posterior group, drains the posterior thoracic wall and scapular region. 3. Humeral lateral group, drains most of the upper limb. 4. Central group, receives drainage from the above 3 groups. 5. Apical group, drains all axillary nodes into the subclavian lymphatic trunk. Y. Brachial plexus, infraclavicular part, formed by the ventral rami of spinal nerves, C5T1, divided into roots, trunks, divisions, cords, and branches. Major branches in the axilla include musculocutaneous, median, ulnar, axillary, and radial nerves. Additional structures. Axillary fat and connective tissue provides padding and facilitates movement of neurovascular structures. Coracobrachialis and short head of biceps brachii. These muscles traverse the axilla. Clinical significance. A. Lymphatic drainage. The axillary lymph nodes are critical in the spread of breast cancer. Sentinel lymph node biopsy is often performed to assess metastasis. B. Axillary artery injuries, vulnerable to trauma due to its proximity to the humerus. Fractures of the proximal humerus or dislocations of the shoulder joint can injure this vessel. C. Brachial plexus injuries. Compression or trauma in the axilla can result in motor and sensory deficits in the upper limb. D. Infections and abscesses. The axilla is prone to infections like hidradenitis suppurativa and abscess formation due to its dense hair follicles and sweat glands. The axilla's complex anatomy reflects its vital role in neurovascular transmission and lymphatic drainage, underscoring its importance in both anatomy and clinical practice.